Good morning, everyone. We'll begin today with an update from Dr. Levine.
Good morning. Vermont is currently at a level of 855 cases and 47 deaths. I wanted to mainly use my time this morning to comment on a number of issues that are making the COVID-19 news in general and apply them to what is going on in Vermont. States across the country and throughout the world at large are taking divergent approaches to reopening. This can prove confusing to many and logically inconsistent. The spectrum is broad, going from what I would characterize as cautious to fairly reckless. But in Vermont, we're looking to the four principal criteria that we've outlined before, and I thought it would be helpful again to review these and put them in context. First, a sustained reduction in cases for at least 14 days. Second, a healthcare system that is safely able to treat all patients without exceeding its capacity and without having to resort to what are termed crisis standards of care. Third, the state is able to test all people who have symptoms. Fourth, the state is able to implement and conduct active monitoring of confirmed cases and their contacts. Next, and this has made the news in just the last day or two, social distancing is here to stay. Expect it to be a part of the Vermont scene even as we reopen Vermont. I'm beginning to like the term physical distancing more because social distancing implies a lack of social connectivity. And as we've discussed a variety of health-related items over the last several years, one of the themes that ties them together often is social isolation. The last thing we want social distancing to create is social isolation. So if we can just be cognizant of physical distancing and trying to remain socially connected, I think that would be far healthier for us all. And remember, this phenomenon is not here forever. But until we have antiviral therapeutics and an effective vaccine. Facial covering is here to stay for a while as well. I have to say one of the prime reasons Vermonters send me notes and letters and emails is to complain, not about this, but when they view others in public who are not wearing a facial covering. I conducted my own weekend survey once again, and I went to the supermarket. I'm happy to announce that every employee that I encountered was wearing and covering and adhering to this rule. And they understood why as well. Regarding the customers, it was in the 80 to 85% range. So clearly a majority. But we can do better, and we really must do that better to protect one another, because we're all in this together. Another national newsworthy item was a look at metropolitan areas across the entire country, looking at the rates of doubling of the disease. I have to say that Burlington, Vermont made the map. It was our only metropolitan area on the map, and it barely registered compared with a whole host of other cities. The doubling rate was estimated at every 3 months, compared to literally days or a week or two in many, many other parts of the country. Finally, the World Health Organization weighed in on antibody testing. so-called serology testing. And they were very concerned about a number of things we've discussed here previously. First, they said the presence of antibodies does not give one an immunity passport. Second, they said it does not guarantee a return to work safely, and that it should not be used for those purposes at this time. The New York Times also provided data and reporting from academic labs in an analysis of the current panels that are available. And they concluded that accuracy is still not yet where it needs to be to guide the use of those tests. There was just too much variability, lack of sensitivity in finding all those who had positive tests, and opportunities for falsely labeling those who may not have had sufficient activity with the virus. I'll stop there for now and return it to the governor.
Thank you, Dr. Levine. By tomorrow, we're likely to reach a milestone most of us could not have contemplated just 2 months ago. 1 million Americans infected by COVID-19 and about 55,000 deaths so far. In nearby Massachusetts, just 180 miles from here, they had nearly 1,000 deaths last week alone, and 169 deaths just yesterday. In Vermont, we've had better outcomes, but we've lost 46 Vermonters. Mothers, fathers, grandparents, brothers, sisters, and neighbors. I want to take a minute this morning and share my sympathies with the families and friends of those we've lost due to this highly contagious virus. It's important we remember them and remind us of why we're taking these extreme measures to protect those we love. To win this battle, we must do our part. It's literally still in our hands. And over the last 6 weeks, Vermonters have stepped up. Your continued sacrifices saved hundreds, if not more than 1,000 lives, and I'm truly grateful to each and every one of you. And even though we've begun to allow some Vermonters to go back to work, the stay home, stay safe order remains in effect, because it's important that we keep this up. If we want to allow more businesses to open back up and start to enjoy the things we haven't been able to do for a while, we must stay vigilant. This unfortunately means staying home as much as possible. Restarting some businesses doesn't mean things are back to normal. And while I believe we'll get there eventually, we're not there yet, and we continue to need your help. As we continue to socially distance or physically stay separated, many Vermonters remain out of work and businesses remain closed. And we know we must do all we can to help them through this. Vermont is fortunate to have a congressional delegation that's been working hard in Washington and who understands the need for the federal government to come through during this once-in-a-century crisis. Last week, Congress passed another funding package, which includes much-needed support for small businesses. And while we're still working our way through all the details in this bill, this funding from Washington should help Vermont businesses in their time of need here in Vermont. So I want to thank Senators Leahy and Sanders and Congressman Welch for their diligent work on behalf of Vermonters. Now, before I turn this over to Commissioner Goldstein to talk about some of the latest resources available in this bill, I want to again make clear, I know how incredibly hard this is for all of you, but in particular, our small business owners. We've heard loud and clear your stories of frustration as well as your fear as you see something you worked your whole life building, struggling to survive right before your eyes through no fault of your own. And workers, too many of whom are still waiting for unemployment checks, who just want to get back to work in some sort of routine of some sort. Believe me, this is not what I want to see for our entrepreneurs, employers, or hardworking Vermonters. But we must put public health first and I believe the steps we're taking, keeping the infection from spreading and taking hundreds of lives, will also be better for our economy in the long run. We're carefully weighing the data every day so that when it shows we can take steps to put more Vermonters back to work, we'll do so. And we'll continue to work closely with the legislature and our congressional delegation and take whatever steps we can to help Vermonters and Vermont businesses get through this. I want to thank you again for all your continued sacrifice and commitment to each other and your willingness to put the needs of the greater good before your own. With that, Mr. Goldstein.
Thanks, Governor. About 45 minutes ago, the SBA has opened up the window again on the Paycheck Protection Program. Just a refresher on that program, that is where businesses apply directly to lenders to get funds to bring people back to work or to prevent them from being laid off in the first place. And part of those funds will be forgiven if they are indeed used for payroll. In the first round of this, $1 billion was approved in the state of Vermont, which ranked us as the third highest per capita. So we were very proud of that and very thankful to not only the delegation for coming up with this, but also all the banks and credit unions and VITA who worked really diligently to get it done. The new bill, as signed on Friday by the President, allocates over $300 billion to this program. And we are expecting even more speed with which this will get deployed. The first time around, banks had to set up a system to do this, and they have that underway. So our advice to businesses that are out there, if you've already applied, make sure your lender has communicated with you that you are indeed in queue. And if you have not heard from them, we urge you to contact them to be assured that you are in queue, because the way that they will be conducting this and administering it is first come, first served. The PPP, which we call for short the Paycheck Protection Program, still we are awaiting some further guidance on the forgivability of the portion, and that has caused some consternation amongst people who are applying, and so we urge you to also get proper guidance and advice from your accountants and other technical advisors. The agency hosted a town hall on Friday with CPAs and members of the task force committed to economic mitigation and recovery, and it is up on the ACCD website for those who want to view it. There are also hyperlinks into very, very helpful guides on how to apply. The other thing that came out in the bill was another allocation for what's called EIDL, which is the Economic Injury Disaster Loan. On that one, we had some success. There were about $12 million was approved in the advance and $10 million in the loans. We expect that they will open that. We're not sure when. There is such a large backlog that SBA is first taking care of those that are in queue, and then we'll open it up. So we don't have a timing on that just yet. The good news is that the agricultural producers will be eligible for that particular program. So that is very encouraging. The SBA district office in Vermont, I know that Darcy Carter is also on the line, is holding a webinar every morning. And again, there's information about that right on our website. So we urge people to go and ask their questions. And just be cognizant to safeguard your information when you're applying on this. Make sure on the Paycheck Protection Program that you're working with a participating SBA lender. We have a list of that on our website, so you could double check that. There are lots of people going out kind of posing as that. We want to make sure you safeguard your information during this time, and I think that our Department of Finance and Regulation will be issuing a press release later today with more guidelines. And we're happy to announce this. We understand there will still be unmet need, and we are working hard to calculate what that is. If you do have questions and want to express the impact that this has had on your business, we also have an impact survey form on our website, and we would really encourage that as we work to develop further relief. Thank you.
with that, we'll open up to questions.
All right, just again, Commissioner Goldstein just mentioned this, but just flagging that we do have Darcy Carter from the SBA on the line, along with our usual cabinet members participating. We're going to start in the room with Calvin, WCAX.
Thank you. In the latest turn of the spigot on Friday, going into effect today, we've heard of some businesses that are kind of interpreting how the newest order, how they kind of want to, and that there might be businesses that are open that shouldn't be open, like retail and things like that. Are you concerned at all that the spigot might be opening up a little bit too fast for some businesses?
Well, obviously, we're watching the data and the science to see what the trajectory is and what that tells us. We want everyone to get back to work, and we're asking for people to be creative in different ways in order to do that. But we don't want them to push the envelope too far. Obviously, we still have concerns about mass gatherings and so forth, especially over 10. So we put these into place thinking that this would give just a little bit of comfort, a little bit of optimism towards the future, and we hope everyone adheres to them and just doesn't go too far. But obviously that happens all the time in different areas. So we'll watch this and make sure that everyone's acting appropriately.
And you and Dr. Levine mentioned that we're not seeing a big increase in cases like in New York or Massachusetts. If our current plateauing continues, how long do you think, or will Vermonters, I guess, have an appetite for, these the closures? Right?
Yeah. No, I mean, everyone is very anxious. Nobody more anxious than me. But I have to put public safety first, and so I've done that. And again, just as quick as we can, as soon as we make sure that we aren't elevating the number of cases and we're not exceeding our healthcare capacity, then we'll continue to open as we see fit. And I hope to do some of that every single week, as long as we see the modeling come just like it has been, and leveling out, plateauing as it has been, and even declining in some cases. But I just want to forewarn, as I did the other day, the more businesses we open up, the more cases we're going to see. I think that's clear from my standpoint, and I'm no expert, but the more people we put out there, it's conceivable that we'll have more people testing positive.
Stuart?
Can I pick up on that? Dr. Levine opened by talking about this 14-day period in which you would need to see cases, I don't know if you said flatten or decline. Aren't we getting pretty close to that number, to that threshold? And also, could you mention serology tests? Who should get one, and is it paid for?
I think we're at that threshold of the 14 days, so we're comfortable opening the spigot the way it's been opened, based on the data, not even on modeling, just based on the data. With regard to serology testing, it's going to be about 2.5 weeks. We'll have another report from the working group regarding that, but for the present time, it's not being recommended by the state, or as I mentioned earlier, even by worldwide authorities in its current state. I suspect that will change very quickly, and we will have some truly excellent, accurate, and validated tests that we would rely on. We'll still have to deal with what do the results mean. If you have antibodies, are you immune? Will you actually not get infected again with COVID? It's not our experience with COVID, with coronavirus in general, the more benign coronaviruses that have affected mankind over really decades and perhaps centuries. So we don't know that for a fact. And then the issue of payment was the final one.
They're expensive, aren't they?
I'm not sure they're any more expensive than what we're already doing in testing for the secretions, oral and nasal secretions. We'll have to address that when we actually want to implement that kind of a testing program.
Will they be paid for? Will they be paid for as testing and treatment is, conventional testing and treatment is, by your insurance company?
I don't have the answer to that.
Governor, getting the hospitals back in gear with elective surgeries and other procedures, is that a possibility in the very near future, if not right now?
Yeah, we're considering that. Obviously, we have capacity in our hospitals. Our numbers are down. We want to make sure that we're working with our neighbors. We've been talking with New Hampshire and Maine, and the Hospital Association has put a plan forward that we're considering at this very moment. So, again, we want to make sure that we have the PPEs that we need, as well as making sure that we're doing all we can to preserve the healthcare system. But right now, it looks good. So we'll continue to monitor, and that will be a consideration over the next week or two.
All right, we'll go to the phones now, starting with Chris Roy, Newport Daily Express.
Yes, good morning. I'm just wondering if somebody can speak about the mental health aspect of all this, not only by being quarantined, by hearing about the potential deaths and the deaths, and how should families talk to young children, or any child for that matter, about what they're viewing on television?
I'm going to let one of the other experts talk about this.
One of the nice parts of where I work in state government is the Agency of Human Services really works in a collaborative manner, and commissioners are talking to each other across all of the various departments. So it's not unusual for, on a daily basis, the Department of Mental Health and its commissioner to report on new initiatives, things that we can put on our website, interactions they're having with the community at large regarding mental health in the COVID epidemic. So these are front and center for us. These are really important. We try to track what's going on in terms of the treatment community, what's going on in terms of adverse consequences. You may have heard at one of these press conferences there was a concern raised about suicide. We've been watching that. We haven't seen a trend. It's a very short time interval we're looking at, obviously, just less than a couple months now, but we're not seeing adverse trends in that arena, which is it's very, very good. So, we continue to track these things. We continue to try to provide useful materials on the website for the community at large to look at, try to implement in their own lives, etc. The second part of the question was?
How should families talk to young children or teens or anybody about that, for that matter, about what they're viewing on television, where you hear about the deaths and having the quarantine, and it might be scary for a young child?
Yes, no, I completely understand that. The bottom line is trying to allow a young child to understand that not everything that they're seeing on TV is what's going on in day-to-day life for them and their family at any moment. Not to be falsely reassuring, but at the same time to be realistic, understand that this is a potentially harmful virus, but then put it in the context of things that the family is doing, that the children can do, and that our state is doing to try to keep everyone as safe as possible, because the real focus should be more on the positive and what we can do to try to avoid having a problem, what we can do to avoid having adverse consequences, and how we can actually work together in a very productive way to get through this together. And I think showing some of those strengths that we all have together as Vermonters, as families, et cetera, is a good approach for parents to take, without denying that there are really bad things going on, in the world and in the country in various locations, but to put it in perspective, so it's not just the overwhelming negative news, which tends to be what people see, and it becomes newsworthy on media, but put it in perspective what good is happening as well. And Secretary Smith's going to add a few words too.
Just quickly, Chris, just to add, one of the primary challenges during this crisis was to make sure that the infrastructure to meet the challenges of mental health, as well as a lot of other issues as well, were met, that the infrastructure stayed in place. And the Agency of Human Services has been focused on not only addressing the crisis of COVID-19, but also making sure that the infrastructure that you just talked about, the mental health infrastructure, remains in place and active. There's been challenges along the way, but I'm happy to report that we've met many of those challenges as we've moved forward. So thank you for the question.
Thank you very much.
If I could just add as well, I think you go back to the statement that Dr. Levine made in his initial remarks about the difference between physically separating and socially distancing, and that's something we have to keep in mind. We want to be physically separated, but we don't want to be socially distanced. And I think that we know, we've seen over the years that mental health and physical health are intertwined. So we have to pay attention to this. And if you can take a moment today or tomorrow and call your loved ones, your friends, family, neighbors, and check in on them and just listen to them and ask them how they're feeling, that goes a long ways towards the mental health aspect.
Okay, thank you.
All right, Kat, WCAX.
This question is about contact tracing. We know this is going to be a big part of the state's strategy as we move forward in containing the virus. We have heard from people who say they tested positive and they were not asked by any contact tracers in any great detail about who they had come into contact with while they might have been able to infect others. Can you address why someone wouldn't be asked in detail about who they had contact with during the time where they might have been able to infect others?
I'm going to let Dr. Levine answer this, but I will say that as we open the spigot, so to speak, and open more opportunities, open up the workforce and go back to somewhat of a normal life, the testing and tracing is going to be a huge part of this. We'll be unveiling some plans later this week, but again, from my perspective, everything has to be working in tandem. Dr. Levine?
Are you able... Oh, Governor, really quick, are you able to elaborate a little bit today on what that might be in those plans?
Not at this point. We're still working on them. I don't want to get ahead of the process, and we'll be hearing more about this in the next couple of days.
Hi, Kat. And from my perspective, I mentioned sort of the big four items for a state to be able to open itself up. If we didn't feel that testing people with symptoms and implementing and conducting active monitoring of confirmed cases and their contacts was going to be a reality in Vermont, I don't think the spigot would have been opened at all. So the plans that the governor's talking about that we'll unveil later on really are a refinement of our strategies in those arenas, but they're not a sudden realization that we can do those. Those were a priori things we thought were very, very much ready to roll in Vermont. Now, when it comes to what is contact tracing, I could tell by your question that at some point in this 6 to 8 weeks that have gone by, there have been individuals who didn't feel that they had adequate attention paid to who their contacts were. That has certainly not been the rule, and I would hope that was the exception. But going forward, that's an absolute necessity that every contact be contacted and understood exactly what likelihood they may have of further spreading disease. The whole fundamental principle of now evolving into a reopening Vermont strategy hinges on our ability to do containment. The social distancing, as we've talked, will continue on as the mitigation strategy. But now we have the opportunity again, as if we're starting all over again from the very beginning, of containing any kind of viral outbreaks wherever they may present. So contacting the person who has the positive test, making sure that they're appropriately isolating, and understanding, no matter how complex their history is, the number and nature of the contacts they had. Those are fundamental disease outbreak strategies that have been time-honored over, decades and longer in public health and epidemiology, and we can only make them even better now. We can't afford to cut corners of any sort. So that's sort of our plan for the future. And that requires, that requires a workforce, and that requires the workforce to be appropriately trained and understand exactly what information they are seeking and how to advise.
So the quickest follow-up question that I think might help some people understand this is maybe what is the threshold for someone to be notified that they were possibly exposed to the virus?
Yeah, so obviously if in the conversation with the case, the person who currently has the virus, has the disease, so to speak, it does not matter how peripheral that contact was. If it was decided that it was worthy of comment by the person, clearly a contact would be initiated. It may not result in the same, if you will, gravity of consequences in terms of what that person needs to do or not do, but certainly at the very least, it would be self-monitoring for development of any symptoms, fevers, etc. And at the most, it would obviously require more isolation, and there's a gradation in between.
Okay, thank you. We'll look for the greater details later this week.
Thank you.
Sean, Chester Telegraph.
Thank you. Earlier, Dr. Levine emphasized that distancing and masks are here to stay. And in the week since the back-to-work order, we've noticed more than a half a dozen outdoor work crews operating at distances less than 6 feet, and we have yet to see anyone wear a mask. How is the state monitoring compliance with the safety rules for those who are now allowed to work outdoors in numbers up to 5?
Well, again, we're relying on education and some sort of guidance in accordance to what we've laid out to try and educate people on what we expect. That's why I talked about training last week. And as we evolve, we have the Labor Department has come out with a series of questions and a template for that to happen, as well as many associations are working on their own plans that are viable. And as we increase the number of people working in different operations, they'll need to have someone who is dedicated to that crew. There have to be like a safety and health officer that is going to be required to make sure that everyone adheres to the provisions laid out in our plan. So at this point in time, it's up to the crews to develop that and to take the training. We've set a date of May 4th. I want to give the benefit of the doubt, as Dr. Levine had mentioned in his unscientific approach when he went to the supermarket maybe a week or two ago and didn't see hardly anyone wearing masks, employees or customers. At this point in time, he went back and they have begun to wear masks, and 80% of the people that he saw as customers were wearing masks. So this is evolving. It's not perfect. It's not a flip of the switch, and it's just something that we have to provide, again, guidance, and there's going to be some social pressure as well to adhere to these procedures.
So just to follow up, to be clear, there is no state monitoring of this order?
Well, no. I mean, I'm not sure, other than taking the test. We're requiring the test by May 4th to go through the proper training and to sign off on that. So at that point in time, we'll develop a mechanism if need be in the future. But again, I think that guidance and education is the best policy. For what?
All right. Secretary Curley, did you have anything to add to that?
No, I think the governor nailed it, but I would just mention that if folks do see something that makes them uncomfortable and they want to report a possible noncompliance for us to provide additional education, there is a link on our website at accd.vermont.gov. Under the Stay Home, Stay Safe sector-specific guidance, they will see a button that says Report Non-Compliance Complaint. And that gives us an opportunity to get out and provide some additional education and make sure folks understand what the expectation is.
Thank you, Secretary Curley. I wasn't aware of that, but that shed some light on it. Thank you.
You're welcome.
Mike Donahue?
Good morning. The town-by-town statistics released today is a start by the health department, but I think Vermonters will find it pretty disappointing. Obviously, the report's got some serious flaws. The map shows there's 44 positive tests in Swanton. St. Albans Town, which has the prison, has 5 or less. That they've had 36 inmates test positive. And I guess the question is, are you sure St. Albans City has 19, or are some of those in the town? Likewise, in Grand Isle County, all 3 cases are in one town in Grand Isle County, but this map makes it look like there's no pocket. Is the health department keeping its local health officer in that community still in the dark? And why don't we let the taxpayers decide about the numbers? Why prohibit Vermonters from getting the numbers instead of just giving them on 29 towns and not all 251?
I think I'll let Secretary Smith try and answer that one.
Sure, Mike, thanks for the question. What we've been trying to do is get out as much information as quick as possible. You asked for the town-by-town breakdown. We've done the town-by-town breakdown. Where I think we're differing is in that town-by-town breakdown. 0 from 5 is one of the categories that we have. We can look at that, but that's how other states are reporting it. And secondly, I've been very careful with this in what we're doing and how we're reporting, and asking the health department to be very careful. Even when we were looking at surge sites, I don't want to put a scarlet letter on people as we're looking at this virus, and I've seen some indications of that along the way. For example, there's been people who've suggested that if we're going to have a surge site, that it should be fenced off. It's not a prison. These are for people that can go to a site in order to recover because they don't want to be with their families or they don't have a home to go to. The second thing is, there was a mention in one of the newspapers where these people should be wearing special uniforms or special markers on them. We're not going to do that in this state. And so what we tried to do is strike a balance here between identifying how many are in a town, per town, and where it would be even identifiable within a town, trying to say whether it's 0 to 5 within that town. Now, if we haven't got everything perfect, I'm certain that the health department would be willing to look at any sort of a discrepancy that's in there. But from what I can see, it's a good start, and we can refine it as we move forward.
No, I understand it's a good start, and but I got an email today saying that they're still relying on HIPAA, which, as we know, does not belong. All the other states say it doesn't belong. There's legal opinions that say HIPAA is not involved here. So I guess we're concerned about that. The other follow-up thing I want is, and by the way, Connecticut has a great site. They actually show the actual deaths and cases by town. It's interactive. You ought to look at their map sometime. But the other thing is that list that was sent out on Friday showing what facilities the health commissioner promised us among other things, does not have like the Vermont Veterans Home on there. And I'm just wondering, A, why that was missing, and B, how do you count the people, say like at Burlington Health and Rehab, that tested positive, the staff members? Are they attributed to Burlington because the facility was there, or are they considered in Grand Isle, Franklin, or Washington County where the person may actually live, and that's where they ought to be listed?
I think normally what we try to do is list by county of residence, and that's what we try to do. I will check on the vet's home and why that isn't there, but as you know, we've expanded our testing policy to include if there's just one positive test, we'll do the entire facility. I think there's been 11 in terms of universal tests that we've done, but Mike, I will check on that and make sure that you have the information on the ones that we have tested universally, as well as those facilities that are called long-term care facilities and others as well.
11 is facilities? What's 11?
11 are the number of facilities that I believe we've done universal testing on.
Okay. Great. Thank you very much.
And Mike, this is Dr. Levine. Just two further clarifications. The Vermont Veterans Home is not a site of active disease, and it has not had an active case in over a month. So it would not be listed as a site that's under active surveillance. And the other part is...
I thought we were getting a list. I thought we were getting a list of all the facilities where you went in.
True. But just wanted to clarify that it's not a site of an active outbreak. And
No, I
second...
understand it may not be active, but it was missing from the list that the state provided.
Right. And the second point is while HIPAA, you may have your feeling about one way or the other, there's also Vermont statute, and the health department does very elaborate statistical analyses to be sure that if we're releasing a number in a town, it cannot inadvertently or advertently identify individuals in those communities. And as you know, we have so many small communities in this rural state that that's where much of that comes from.
But when you have inmates, and there's only so many inmates in a prison, and you say 36 of them have tested positive,
Yeah, we'll get
there's a
that.
likelihood that 15 deaths.
Right. We'll get back to you on the prison.
Great, thank you.
All right, we're going to move to Joe at the Barton Chronicle.
Hello, Governor. In your introductory remarks, you said that you expected to see some kind of increase in the number of cases as restrictions are lifted. I understand the need to take some risk in order to get some benefit, but I wonder how and who will be judging the numbers as they come in to determine whether the spigot needs to be shut back down or whether it can be opened further, and what criteria they will be using.
Yeah, we'll be working, obviously, in connection with the health department, Dr. Levine in particular, our EPI team, to make sure that we're not exceeding our capacity and that we're not taking any undue risks. I just think from a common sense standpoint, the more we open our doors, so to speak, if we decide, at some point, hopefully we'll open up our campgrounds and state parks and so forth, and there'll be more people coming into Vermont at some point, and that may bring more cases. So I just want to prepare Vermonters. I don't want them to get lulled into this complacency that we're somehow insulated from the rest of the world. When we see in Massachusetts and Boston in particular, where we had 1,000 deaths, almost 1,000 deaths last week, and 169 yesterday. So again, I just want everyone to be realistic about what this means. The more we open up and the more people go back to work, the more we're interacting. the chances are we'll see a few more cases from where we are today. I hope that doesn't happen, but I just want to be honest and transparent.
Thank you.
Tim, Vermont Business Magazine.
Hi, good morning. I have a question about the obligations and requirements of employees and employers going forward as we open up the economy. There's been some questions to us about whether an employee has to go back to work and whether an employer has to basically rehire that person if they're choosing not to come back, if the worker's not choosing to come back because they are making too much money on unemployment insurance or they don't want to wear a mask at work. And what are the obligations and requirements on both sides of that, Governor?
Yeah, admittedly, it's probably a little bit gray. It depends on the situation and the criteria. I may ask, I don't know if it's Secretary Curley, Commissioner Harrington, or anyone who might be able to answer this.
Hello, Governor. Commissioner Michael Harrington, Department of Labor here. Just from an unemployment insurance perspective, if an employer were to reopen and offer someone back their job who had been temporarily furloughed, that there would be an obligation for that employee to take that employment unless they fell into one of the other categories that essentially allow them to remove themselves from the workforce. And so that would be things like staying home to care for a child who is out of school, caring for a loved one, maybe who had been impacted by COVID-19, or maybe they themselves have been asked to quarantine or isolate due to a risk of infection. So again, if they don't fall under one of those additional exemptions, the employee is required, as long as they're being offered the same employment, both the same position, the same pay, and the same amount of hours, they are obligated to take that or risk potentially becoming ineligible for unemployment insurance benefits.
I'm going to ask Commissioner Goldstein to add.
Yes, we've been asked this question quite a lot about people earning more on unemployment than their current job, but as Commissioner Harrington said, they really would be proved ineligible for unemployment if they were offered a job and didn't come back. The other thing I wanted to add is that for the employers that are taking out the payroll protection program loan, they are able to pay their employees more. So if they have to raise their rate of pay, they could get that as part of the PPP loan. There are guidelines. It can't go over the amount that is permitted, but they surely could pay additional wages to compete.
As a follow-up to that, Joan, maybe you can answer this, or maybe Michael Harrington. What if, in any scenario, an employer is now open and needs to hire someone, the original employee cannot come back to work? Can they then replace that position without having their experience rating harmed?
I think that's a Commissioner Harrington question. I'm not sure about the experience modification factor on that.
Yeah, the intent of the law that was created was to allow flexibility, to be mindful of people's health, to encourage people to put the health of themselves and their family first without negatively impacting the employer. I think if there was a case where someone was protected under the law to allow themselves to be removed from the workplace, if the employer chose not to bring that person back, I think that would be a conversation we'll need to have at the department. I don't know whether or not the law contemplates that. Certainly, it would not be within the spirit of what the law was when it was created. Certainly, employers can certainly remove someone from their place of employment and replace them. at will, but whether that would have a negative impact on them, that I think is something for additional conversation.
And if the worker just chose not to come back, I assume it would just be like any other, the regular UI rules in which the employer would not be harmed in that case.
Yeah, that would, as long as they fell outside of the COVID Act that provided additional protections, if they just decided they were not going to return. Again, if someone said that they were not going to return, that would be considered a quit, and therefore they would not be eligible for unemployment insurance. So there would be no negative impact to the employer in that case.
Thank you.
All right, Lisa, AP.
Thank you. Governor, can you give us a sense of how much you're hearing from businesses or workers who want the economy to reopen more quickly? You or your administration, are you getting, hundreds or thousands of calls or emails? And are you consulting with businesses on your new orders in the easing of some of these restrictions?
I would say, from my perspective, any of the businesses I've spoken to are certainly understanding of what we're going through and are adhering to this, but they're as anxious as anyone to get back to business and open their doors, but they want to do it in a safe manner, the majority of them. In terms of the number, I'm going to ask maybe Secretary Curley if she could, if she has a sense of how many.
Yeah, I don't have a strong count. We do hear frequently from employers, and this is something we're used to. We communicate regularly with employers around the state, and certainly this point in time asking people to really communicate with us. So we have a lot of interaction going on. Again, folks offering up suggestions on how to do it safely. We're compiling all of that, and we are sharing it with our restart team to talk about it, and that all goes through, health and safety checks as well. So I think the dialogue is really good. I think we're very open. Folks can email us ideas and they can access us, and I hope that they would agree that we've all been responsive in the exchange.
Was there another part to your question that didn't answer?
No, I think that was it. And then I had one other question on the town-by-town tally of cases, the breakdown. Do you think there's any out-of-staters may have brought some of the virus to the ski towns, given the numbers in places like Wilmington, Stowe, or Woodstock?
I'll ask Dr. Levine to comment on that.
Yeah, we're quite aware that there have been out-of-state people who have come into Vermont and been diagnosed shortly after arriving in Vermont. That's a part of the reality of a virus knowing no borders. What percentage of that number of cases is hard to tell. Likewise, Vermonters who actually didn't reside in other states but flew home from Spain, Italy, other parts of Europe brought virus. So they still get tallied up the same way, and we don't think any more or less of them because of the fact that they acquired the virus in their travels. It's part of the reality of how COVID has become entrenched in the country at this time.
Okay, thank you.
All right, Brittany, Local 22.
Hi. So my question is for Dr. Levine. There's a lot of talks right now about a possible second wave of the infection, happening maybe in the fall. I was just wondering if this is something that you're concerned about, and if it does happen, does Vermont have the testing capacity for a second wave?
Yeah, thanks for that question. I think any person in public health across the country is concerned about the second wave. And it would be far less concerning to us if we were all crystal ball people and could actually figure out, number one, will it truly happen? Number two, when will it truly happen? And even amongst the public health community, there's, I'll use the word controversy about what the timing would be. Would it be over the summer? Would it be in the fall? Would it be not till next winter? Very challenging to understand that. It gives us all job security because what we need to do, and will continue to do, is look at the data. And we will basically examine the data as constantly as we're doing it now. Just like the data is driving how Vermont is reopening and restarting, and we're carefully looking at all the same metrics and parameters. We'll continue to do that through the fall for sure, and if there is going to be a second wave, another resurgence, we'll be able to know that. We have substantial testing capacity, so the goal is actually to pick it up early enough that you don't let the cases become overwhelming in number. So the fact that we will have that substantial testing capacity already front-loaded into the system means that if things begin to evolve in the way you've described, we'll know as we're beginning to ascend on that peak. Just like we knew this time around, even when the country didn't have as great a capacity to test, we in Vermont knew where we were on that, we'll call it the ascending limb of the peak, and we're able to make all of the interventions that we've talked about with mitigation strategies that have evolved over the last several weeks to months happen just because we were able to pick that up early and watch our progress along that curve. So I have no doubt we'd be able to identify that quickly as well.
Thank you.
I just think we ought to go back again to reflect on how far we've come in a short period of time. It was just 6 weeks ago that we declared the state of emergency in Vermont. Look how far our testing has come as a state and as a country since then. We'll be far more prepared, much more prepared than we were initially if there is a second wave. And again, watching the modeling, but also we're seeing so many advancements in testing. I talk with my fellow governors almost every day about some new advancement or some trial in terms of testing and some of what others are foreseeing. One governor was talking about the possibility of some sort of a litmus test, physical litmus test that will tell immediately whether you're positive or not. So there's going to be all kinds of advancements. We've come a long ways in about 6 weeks. That is about 4 or 5 months ahead of us. And again, we'll be much more prepared as a country to face that when it comes, if it comes.
Thank you.
All right, Mike, Newport Daily Express.
Yes, good afternoon. Thank you, guys. If you don't mind, I'm going to change the subject to the Vermont State College System, if that's okay.
Sure.
All right. We're less than a week out from the decision not to vote on a potential thing that could have seen 3 of our campuses be shut down in a reorganizational management thing. I was wondering if you could speak to any updates that you might have now about the Vermont State College System, what the Board of Trustees, the legislature, or the Chancellor might be doing this week to start setting forth a new plan, potentially in funding the VSCS.
All I can tell you is, from our perspective, I know the legislature is considering this, working on this. I believe they've asked for financials to determine when they would actually run out of money and possibly take a look at some of the provisions of of how they got to this point. From our perspective, we've given it to the legislature, hoping that they can carry the ball on this and find some sort of resolution. But I can say, as I said before, they didn't get into this position overnight. This came long before COVID-19. So I'm not sure what money is going to be available for this bailout of the Vermont State College system. I can say the guidance we received the other day, just 3 or 4 days ago from the federal government, precludes us from using any money from the CARES Act for this purpose. So I think time will tell. Obviously, we want to help in any way we can, but I'm not sure where the money is going to come from at this point. But the legislature will take this up.
Okay, thank you guys for your time.
Thanks, Mike. Up next is Collins, 7 days.
Hi, so I have a few questions about unemployment. First, the 8,300 people who received those $1,200 checks, I think last week, any update on whether, have all of their claims been processed through, or are they all receiving weekly benefits now?
That's a Commissioner Harrington question.
Yes, thank you, Governor. No, they are not, but that is more to the fact that some are still being adjudicated through the process. A lot of those people have been put into the system. Again, some of those are now eligible who weren't eligible but now that PUA is available. So again, there are still some of those people who either may not be eligible or are still going through the adjudications process, but then there are others who would have become eligible through some other aspect, whether it was an issue that was cleared or the new pandemic unemployment assistance program that was launched last week as well.
Okay, and is there any, Governor, this might be for you, is there any discussions going on about another sort of relief move along the lines of a check, especially considering the first one probably got them through 2 weeks of the federal benefits, and it seems like some of them are still waiting to get in the system now.
Yeah, I don't know how many people we're talking about. Obviously, our first preference is for them to go through the UI system, the PUA, but again, if that doesn't happen and we still have a backlog, we could take another step forward as we did before and make sure that people get money in their pockets to put food on the table and pay their bills. So we haven't talked about that specifically, but that would be my intention, and we've proven we could do it before. We'll do it again if necessary.
And then lastly, has there been any indication from the federal government about whether Vermont could face any ramifications for sort of sidestepping some of the requirements? I know Commissioner Harrington had alluded to this a couple weeks ago. Have we heard anything?
We have not heard anything at this point in time, but again, that will come with an audit and probably later on. I believe the USDOL has their hands full with the magnitude of this on their own system as well as with other states. So we won't be alone, I'm sure, but we'll wait and see what happens in the future.
Thanks.
All right, thank you. Aaron, VT Digger. Aaron Digger?
Can you hear me? Yeah, okay. So looking at these town-by-town statistics, as a data reporter, I'm calculating it out a little bit, and I'm finding that the towns with the highest per capita rate of cases are a rather different list than the towns with the highest total number of cases. Have you considered releasing the statistics by the per capita rate?
I'm not really sure I understand the question, but I'll let either Dr. Levine or Secretary Smith try and answer that.
Aaron, I'm not sure I understand the question, but we can take it offline. I want to make sure that we accommodate sort of the data aspect of this in a way that we can. So let's take that one offline. Let's try to figure out the best way to get the data that you need.
Okay, I will follow up with you. My other question is, we don't necessarily have any details, public or the media, on how many tests have been conducted in different areas of the state. Have you considered releasing that info at a county, town level, or any other, even the individual facilities that conduct tests, so we can be sure that, this town by town data isn't just the result of who's getting the most testing?
Again, I believe everyone who has requested a test through their provider gets a test. So I'm not sure what information would be needed to correlate what you're trying to get at. Maybe Dr. Levine.
So currently, we definitely have the total number of tests that have been done in the state released, which is in the 14,000 range, I believe. You would like it to be more listed like each town or county?
Or even by county, as you've released the case numbers by counties. What I'm hearing from people is that the concern is the lack of primary care providers and the distance to different healthcare facilities in rural areas is discouraging people in rural areas from getting tested. So I'd like to know, is that true? And, releasing the data is probably the easiest way to find that out.
Right. I mean, the way we've tried to work through that is in setting up test sites to accommodate the concerns, just like you stated, that perhaps we weren't sampling a part of the state as well as another part. When we've set up those test sites, we've had a very limited number of tests that were performed at those sites, and they did not generate the volume that we anticipated. So that's a rough indicator that perhaps there was not the need for increased capacity for testing in those areas because it wasn't being accessed when it was available. That's about all I can say about that at this time. But we can actually, with our health surveillance team, we can look into the request you just made and get back to you with that.
Okay, thank you.
Andrew, Caledonia Record.
Yeah, hi, good afternoon. I'm curious about, as things continue to open up in terms of businesses and activities, can you describe the implications of a positive test going forward? I'm imagining a business that's been allowed to open back up and an employee tests positive. Are you envisioning quarantine requirements being applied to individual businesses as things go forward, kind of like camping out hotspots in a grass fire?
Yeah, that's what I would envision. I'd let Dr. Levine weigh in, and we'll, unfold our plan in the coming days. But from my standpoint, whenever we see any activity, that we will go in and try and smolder that ember so that it doesn't spread. And so if it means going in to trace, testing and tracing have to go hand in hand, I believe, in terms of trying to mitigate this. So that would be my thought. But again, we need the testing and tracing capabilities enhanced in order to do that.
Yeah, Dr. Levine here. I just want to emphasize the intensity of what contact tracing is all about. These are very, if I could use the word, exhaustive interviews to really try to ascertain where there may be relevant contacts and where there may not be. And that's built into the system. So it may not mean that one positive case shuts an entire industry down or what have you. It may have to do more with what was that case doing, where were they at the time, where were they the 48 hours before they became symptomatic, who was in contact with them, and it may not have the kind of implications that you're alluding to, that an entire business would suddenly disappear for 14 days or what have you. Or it may. Again, we would not know until we really did the depth of tracing that needs to be done. But it's really, going to be on a very case-by-case basis. They'd be very challenging to do generalizations about how the process would play out across any set of circumstances. I hope that helps you. Because even now, there are healthcare workers working on healthcare facilities who have tested positive, but those healthcare facilities haven't closed down so that Vermonters can't access them. The appropriate amount of isolating and contact tracing have occurred, and strict adherence to return to work schedules so that business could continue as usual without putting other Vermonters at risk from that point on. So that's how we look at these things, and it really does need to be done very analytically and very objectively, but also realizing that it's an exhaustive process, and the goal is not to open things only to shut them if that can be prevented.
Sure. But in the scenario in which you're looking at things on a case-by-case basis, let's say that, an employee does test positive and there was, to the contact tracing team's assessment, a risk of other employees at that operation being exposed. Do you envision enforceable quarantine orders as a tool going forward in order to prevent these hotspots from flaring up? And if so, who would make the decision on how those orders get applied?
Sure. So quarantine is a recommendation, obviously, but it does come with the possibility through the authority invested in actually the three of us up here to be able to make it more enforceable if we view there being a threat to the public's health. So that's how that works. I have to say that Vermonters have not been pushing back on what we've asked them to do from the beginning until this point in time, and actually have not had to use that authority in any meaningful way. So, it's in addition to what's happening to the public, what's happening to the business, what's happening to families, to roommates, to people who live there. So these decisions have implications across the board, but generally people want to do the right thing, and they want to make sure that they put as few people at risk as possible. I didn't even mention, on top of all the other things that we're talking about, there's clearly, recommendations that would be made at a business regarding disinfection, regarding the management of the whole environment that would also play into decisions about how this plays out. So it's a very comprehensive process, and if we needed to exert the authority that's invested in us, we certainly would if there was a threat to the public's health. But at the moment, people have been very cooperative.
All right, we'll go to Greg at the County Courier.
Hi, Governor. We're hearing that there are paraeducators and substitute teachers who are not qualifying for unemployment because they don't meet the minimum threshold for wages. And as we heard earlier, this is also coming at a time where there are employees in the state that are making more on unemployment than they would if they were at home. It seems like a little bit of a systemic problem here. Are you trying to find a stopgap measure to get some of these employees that wouldn't normally qualify a little bit of money?
Again, I don't know what the minimum is in order to qualify for unemployment. Maybe Commissioner Harrington could add something to this.
Yes, sir. So again, each case is a little different, so I'm going to speak in generalities. But if someone is not eligible for general UI because they didn't earn enough within a certain period of time, that could potentially make them eligible for pandemic unemployment assistance. And I mentioned this at Friday's press conference. There is a cohort of people that fall into that category. This week, we should be expanding that program to allow those people in. I said that kind of the first wave or phase was self-employed and independent contractors. This will be kind of the next wave coming in, hopefully this week. And so the other piece to that, too, is something that the U.S. Department of Labor called educational wages, and so there are some disqualifying impacts based on that. However, and most of those claims need to be adjudicated. I believe we've found a workaround for that, and That's not necessarily to say that we're disregarding those issues, but we have found a way to allow those individuals who may have been held up due to educational wages in our adjudication system to continue forward through the filing process, and that also came up on Friday as well. So I'm hoping that this week we'll have 2 new groups of people that are able to start filing through the process. And that should resolve essentially the situation that you just brought up in your question.
So, Commissioner, quick follow-up. What is the minimum and maximum threshold for people in the pandemic unemployment?
So there isn't in pandemic unemployment assistance, there isn't necessarily a minimum threshold, but you do have to be determined to be ineligible for general UI, and then there's a series of calculations that occur. But in most cases, such as these individuals that you're talking about, if they weren't eligible because they didn't earn enough in their base period, that would then translate into them being allowed to at least receive some benefit under the PUA program. That would be my understanding.
Thank you.
Yes, sir.
Avery, WCAX.
Hello. As more businesses start to reopen, what has been the discussion about childcare for those workers who are going back? Obviously, there's already some childcare facilities for essential workers right now, but what about those who are deemed technically not essential but are going back under these executive orders as they roll out?
I'm going to let Secretary Smith answer that one.
Here's the plan. We are starting to look at how we're going to be opening up childcare facilities as we start opening up these various operations with as we sort of turn the knob as we have done the spigot, opening up the spigot. Here's I will say this: I don't think we're going to see any sort of major movement in childcare to about June 1st, if I'm looking at a date right here. So plans are in place, but childcare openings on a scale that are larger than the essential workers, I think June 1st is the date that I would look to, assuming that everything goes as planned right now. And again, it's going to be we're going to coincide with how we're opening up industry on a sort of a slow basis and turning up the knob as we move forward. So I would say stand by to June 1st.
Thank you.
Pete Hirschfeld, BPR.
Commissioner Harrington, I gather you have taken lawmakers up on their offer to volunteer to help with the claims processing system. Can you talk about the training they'll be receiving, what exactly they'll be authorized to do at your department, and the extent to which you think their involvement will assist in addressing the backlog?
Thanks, Peter. A lot of those details are being worked out as we speak today in terms of what the process will look like and to what level they can clear issues or assist people on their own versus what would need to come to the department. So again, a lot of that remains to be seen. I think at this point, what most legislators are doing is capturing names and contact information for other individuals or their constituents, and then we'll determine the follow-up, whether that happens at the legislative level or at the department level. I will just say as a cautionary tale that I think what we're also trying to prevent from happening is just creating another valve, if you will, in the system that gets overloaded and overflows with points of contact. that is just another place that people get bottlenecked in. So we're trying to develop a clear process that would allow for timely resolution. And really also we're trying to do our best to prioritize maybe those people who are in emergency situations versus someone who is just looking for additional information or is looking to make a minor correction on their application versus someone who may have been held up within the system and hasn't received benefits over a number of weeks. And so also looking at ways we can assist in those and give more timely service to those people in emergency situations.
Quick follow-up. You referenced that the spreadsheet, I guess, for lack of a better word, that lawmakers are filling out on behalf of constituents who are having trouble with the system. Are people who are still struggling to get UI benefits better advised to go through that constituent services tool that lawmakers are using or directly through either your call center or website?
I would definitely say that their primary point of contact should at least be through our multiple call centers and our website to start. And then if they feel like they've hit a wall and can't get through, they should reach out to their legislator. Again, what we are finding in some of these cases are people who have just, for whatever reason, have gotten caught up in the system. Some of those are system specific, but in many cases, it's also information that needs to be cleared, or the way a question was answered on an application made them ineligible, and they are wanting to correct that piece of information, or they haven't filed for a week yet. For a weekly benefit. So it ranges kind of the whole gamut of different situations that could potentially get them caught up in the system. So again, their primary call first, they're one of our call centers.
Commissioner Harrington, maybe you should remind Vermonters as to where we're at in terms of the call centers and the enhancement this week and what has started today and so forth. So they get an idea of how we're ramping up in terms of the call centers.
Yes, sir, Governor. Thank you. So we've been operating two essentially triage call centers. One has been through a public-private partnership with folks like GMP, Vermont Gas, Efficiency Vermont, and other state agencies. That call center has over 100 people in it answering calls at any given time. But in addition to launching the public or pandemic unemployment assistance program, we also launched a contracted solution for call center services. They have been ramping up and have held training sessions for their employees on Thursday, Friday, Saturday, and today. And they should be up over 50 call center representatives by noon tomorrow, and we're on the track to head towards 70 or more call center representatives shortly thereafter. So each day our capacity is growing as well in terms of the number of calls we can take, but also with launching the pandemic unemployment assistance, we continue to tweak or update that application to make it more public friendly and also as much self-service as possible. And there's even minor changes that are happening today and tomorrow just to give the claimant more ability to make additional changes or place them in contact with someone within the department to resolve an issue more quickly.
All right. Patricia Bennington Banner.
Hello, can you hear me?
We can.
So my question is somewhat not aligned with the questions thus far, pivoting a bit. For weeks now, we at border crossings, VTrans has had employees in cars and trucks, every day, all day, monitoring out-of-state traffic. The original reason we were given was that had to do with establishing a baseline for people that were coming in. I'm wondering if that's still the purpose and how the information is being used and what the results are of the information that has been collected thus far.
Yeah, that, we've established the baseline. As you might have recalled, there were a number of people who were complaining that we were getting flooded with people from out of state into our state and bringing the virus with them. And we wanted to find out if that was indeed true. So we have developed that baseline. We want to continue to monitor. We've downsized the operations. It's not at every port of entry, but only the major ones. And we've reduced the hours, but we still want to pay attention, especially as the weather gets better. And we're seeing, again, as we open up some of our opportunities in Vermont, we want to make sure that we're paying attention and bringing all that information together to figure out what we should do next and what was the effect of what we did. Just as an example, if we opened up campgrounds, for instance, we might want to know how many people were coming in to the state from other parts of the region with campers, and to see again what impact that might have on the number of positives we're seeing. So again, it's just information. We still think it's viable and something that would be beneficial in making decisions about how we open up this economy.
And are license plate numbers being collected, or just like in the beginning where it was just to see which state they were from?
Yeah, no license plate numbers being taken at all, just the color of the plate.
To determine which state it's from?
Yeah, just to get a sense of where everyone is coming from. For instance, I'm very concerned about what we're seeing in Massachusetts right now. And again, we're not isolated here in Vermont. The boundaries don't protect us. And when we see the number of deaths last week in Massachusetts alone, it gives me great concern. And so I want to make sure that we protect Vermonters and do all we can to make sure that we're not taking steps that would put them at risk. And so that's why, the 14 days of isolation, self-isolation for those traveling into the state remains in effect.
All right, thank you.
Thank you, Patricia. Colin B.T. Digger. Colin Digger.
Hi, can you hear me now?
We can.
Hi, Governor Scott. Thanks for taking all these questions. I was wondering, you've got a few bills headed to your desk probably in the next few days. One is about hazard pay or emergency worker grants. I think they're calling them. Another is the eviction moratorium. And thirdly, there's some changes to property tax and how municipalities are able to abate taxes. I'm wondering what your position is on those three bills.
Yeah, I'm not aware that the hazards bill has passed the Senate and the House.
Right, I said they're likely to be headed to your desk soon.
Well, likely and heading are two different situations.
Okay.
I know that there are at least two bills that we have been a part of and advocated for, and they have complied and have rushed them through to get to my desk. So I will be signing those two bills that are coming across. In terms of the hazard pay, again, the guidance we received last week doesn't give me great hope that they'll be covered under the CARES Act. So my question would be to the legislature, where do you want that to come out of? If it's out of the general fund at this point in time, we're going to see some budgetary problems just for fiscal year 20, not to mention greater concern for 21. So we'll see what happens. Again, great idea, great concept. They're doing it for the right reasons, but we have to ask ourselves the question: how are we going to pay for it? And so that's the question I'll have, and we'll see what happens. I don't believe it's even passed the Senate at this point, so it's got a long ways to go.
And the eviction moratorium, is that something that you'll support?
Yeah, again, I don't know where it is in the process, if it's passed both the House and the Senate, but I've said we'd be working along with them and trying to provide for that relief. I could have taken executive action initially, but preferred to have it go through the legislative process. So we'll see where it's at and if it comes to us. And again, I don't have any problem with the concept, but want to know the details.
And if I could ask one question following up on something you said earlier, you repeatedly said that advice on wearing masks is preferable to you than an order. If you think that people wearing masks, could prevent the spread or could save lives, why are you so hesitant to make that an order?
Well, I think, again, as you've seen across the country, I don't know, only New York has put that into place. And then you have to ask yourself, how are you going to enforce? What are you going to do? Are you going to start issuing fines for that on otherwise burdened Vermonters at this point? I still feel the guidance and education is the best policy. Lead them, not drive them. And if we have to take further action, we will. But at this point in time, as Dr. Levine had noticed in the grocery store this weekend, people are complying. We've come, again, a long ways in just 3 or 4 weeks, and particularly with facial coverings over the last 2 weeks. So I have great hope that people want to do the right thing, and they'll begin to adopt this measure as it becomes more socially acceptable.
Thank you, Governor.
All right, John Dillon, VPR.
Thanks. My question is also legislatively related. The Joint Fiscal Committee met this morning. They've got a plan to review and have input into the $1.25 million coming to the state under the CARES Act. And basically, they're talking about giving the administration authority to spend 60, sort of no review, then 150 million authorized to the administration for time-sensitive critical needs that can't wait for the normal appropriations process. But then they want to have a hand in and through the normal budgeting means of the other $1 billion. Is that acceptable to you, given the scale of what we're dealing with and the likely cost and the speed at which things have to be dealt with?
Yeah, again, I don't know about the exact details and how much they are willing to allow us to spend. But as we've seen in other states, the governor has taken action and has not included the legislature. I have said from the beginning, and I've had some talks with the pro tem and the speaker, wanting to give them comfort that we're not going to do that. We want their involvement. We want to work together. And we're in this crisis together, and we'll work our way out of it together. And that means having some dialogue about how we spend the money. And I welcome their involvement. So, again, unlike other states, we're not going to have any court battles over this. I've relinquished the authority in terms of trying to work together. So we're unique, and I think it'll benefit us in the future. I think that they will be flexible in adhering to what our needs are in a short period of time, and we'll continue to work together.
Do you have in mind, though, how much money you want discretion over to spend without legislative review?
Well, I don't have that off the top of my head, but I know we've spent a great deal of money thus far over the last 5 or 6 weeks to deal with the crisis at hand. We want to make sure that we have the money to pay that, plus some flexibility in the future. So our Commissioner of Finance, Secretary of the Agency of Administration, I believe, have been working with the legislature on what we would hope to have available to us.
Okay, thanks.
That's all of our callers today.
Okay, thank you very much for tuning in. We'll see you on Wednesday.